Have you done any prospective high versus low dose trials? I take it that you would never let your patients go like a placebo
No,
group.
no.
So have you considered low versus high dose to,
no.
so that the rest of the world might start to believe this?
Well,
I tell
actually,
you, I'm one of the first believers in town, but I'm skeptical that double-blind trials will really show that much difference. So I need to see it. See.
our results have been so overwhelming that to give them low dose, I mean, that would, like, these patients are critically injured. Somebody coming in with a tree on them 50 feet to give her 1,000 IUs of vitamin D would almost be criminal as far as I'm concerned. And then the seriousness of these traumatic brain injuries, they've been shot by hollow point guns and third of their brain tissues blown out. So to give them low dose or no dose would almost be criminal, when these are patients that actually have no chance of survival, period. They wouldn't survive anywhere else.
What do you think about? I mean, you and your team clearly believe that vitamin D, big dose, early and steady, is very, very important. But you'd agree that much of the medical world hasn't accepted that.
Well, if you notice, any research takes 10 to 13 years before it becomes standard of care. Surgeons used to cut everybody's stomach out that had ulcers till somebody drank the H. pylori and showed them that it's the H. pylori that caused ulcers. The guy that came up washing hands was laughed out of medicine. So it normally takes 10 to 13 years before anything becomes standard of care. Doctors, I know, are very conservative. They're skeptical. And then in medical school, we were just taught eat 3 meals a day.
How much
you
do
can be
you
healthy.
take every day?
I take 5,000 IUs a day. My mom is 90 years old. She takes 5,000 every day. She's never been toxic.
Testimonials don't constitute medical evidence. So.
I didn't say that.
Well, you did. You
yeah,
did.
I didn't say what I do constitute
Well, you
medical
did say that
evidence.
what your mother does.
I said I'd take 5. I said my mom takes 5. I'm just letting you know.
I have a question about the cost involved and about any conflict. Here in Juneau, getting a vitamin D level to the consumer costs about $250. So if you're talking about everybody in Juneau having a yearly vitamin D level, you're talking about a very significant amount of money. Do you have any conflicts as far as either production of vitamin D or the measuring of vitamin D? You or your team have any conflicts or investments that you might want to discuss?
No, I have no disclosures. Actually, I fund my own research. I have not taken any money from anybody, period. So I pay for my own research. I pay my own statistician. I pay for my own travel, my own posters. So everything that's associated, I pay. If I give somebody a type of manuscript, I pay them out of my own pocket and stuff. So I have not taken anything. I've had companies offer me free vitamin D. I've refused. I've had companies offer me money to do the research. I've refused. So I don't take anything from anybody. That's why I did it that way, because I didn't want any conflict. Sure. I didn't want there to be any doubt.
You've presented here a bunch of observational studies and a bunch of anecdotal studies. But as you know, the standard of medicine is double-blind, placebo-controlled studies. I saw one out of Tehran where they used a combination of progesterone and vitamin D in trauma. But the studies I've seen from you have not been double-blinded and controlled. So could you comment about any data out there that we're missing?
No, like I stated earlier, I think it almost would be criminal in this case with these severity of the patients I'm dealing with. I'm dealing with a whole different species of patients here. I mean, these are people that come in with no blood pressure, no pulse, no heart rate, come in desaturated, they have to get trached in the emergency room. So these people don't have any time. So I don't have time to put this patient on to a lot of these patients. You think this lady would have survived if I had put on a placebo with the tree through her? No.
So can you talk a little bit more about the incidence of skin cancer? And I mean, there seems to be two competing things here. We're supposed to stay out of the sun because the incidence of skin cancer is climbing, but at the same time, that's what creates vitamin D. So there's just a conflict there, and how do you reconcile that conflict?
Okay, we've already reconciled it with the dermatologist, and the way we've reconciled it is that we agreed to this: go outside, put the sunscreen on your face before you go outside, leave your arms and legs unexposed for 15 minutes. After 15 minutes, put the sunscreen on. And so dermatologists are okay with that, and so that has worked very well.
Do you bother measuring levels in right away in the ICU?
Yes, we do. First thing we did before we started doing anything was just check and see if there was a problem. So we started measuring vitamin D levels on everybody the minute they hit the door or within 24 hours of admission.
How fast can you get the level back?
It takes us about 2 to 3 days to get the level back because it's a send-out
So it
level.
doesn't really affect what you do in the first 2 days?
What we did was first we quantitated what the problem was. We found out that 98.8% of our patients are vitamin D deficient and only 1.2% had normal vitamin D levels. The average in our unit is about 12, so it's nowhere near 30.
So-
Then in the first 24 hours, your level drops 50%.
So how do you give the vitamin D the first day or two?
Okay, we give it down the NG tube and stuff. So most of our patients are intubated, and if they can take it PO, we give it to them PO, but if not, we give it to them down the nasal gastric tube.
And what formulation is it?
We use a 50,000 D3.
50,000 D3. There's no IV version.
Calcigex is IV version, but there's a shortage of Calcigex, so we just have to use the PO now. United States and Europe, they have a IM injection, but it's not FDA approved in the United
I
States.
checked, there's no IVs.
No.
The daily
Calcigex is small.
The daily vitamin bag has, the yellow bag for IV vitamins has 200 units in it.
No, there is Calcigex. Calcigex is vitamin D. So we used to give our patients Calcigex, but there's a shortage of it and stuff. So it just kind of temporizes them until we can get them in the PO.
I had a question about one of the statistical things that was up there on the board. It talked about the difference between mortality rates. Actually, wait a minute. It was, it was mortality rates for the African American women who came in with very low rates. I think it was 7%.
14.6%.
Okay. And there was also then, there was African American women were at the lowest rate for vitamin D levels in their bodies, then African American men, and then white Caucasian women, and then Caucasian men. And you said that by giving high doses of vitamin D, you were able to affect that rate across the board. And I was wondering if when you did that, if the mortality rate or the survival rate, to be more specific, for the African American women approached that of the white women, or if they only raised 5% above where they started, or did they come even with the white women for mortality rate?
We're even across the board. All
Even across the board.
Mm-hmm.
Now, maybe this ties in with what these gentlemen were addressing, which is the double-blind study. Is it a valid study if you study what your emergency room mortality rate and your ER mortality rate is before an intervention like putting everybody on high-dose vitamin D, and after a change like that, is that a valid way to look at a study?
Yeah, well, you have all types of studies. You have prospective studies, you have randomized studies, you have double blind, and so you have different types of studies. There's more than one different type of study to do. And so if you look at most of the studies that have been done, a lot of studies are prospective, so there are different types of studies you can do. So randomized controlled trials is not the only way. If you go back and look throughout history, some things were done just on observational. Lister noticed that when doctors washed their hands, mortality rate went down from delivering babies. Doctors used to deliver babies with dirty hands and stuff. So observational studies are, so you're saying that as a surgeon, I make diagnosis off observation. I interview patients and they just tell me they got nausea, vomit, abdominal pain, right lower quadrant pain. I don't need a CT on everybody diagnosed with appendicitis. So we do have clinical judgment and we do use observation in medicine. So that is valid. So basically you're saying that if you don't use tests, nothing is valid, and that's not a valid point.
So basically what you're saying is you don't need to try making your hands dirty going back and treating patients to see if more of them die for a double-blind study type of thing,
Well,
which kind of makes, I can see that where that would make sense.
Yeah, that would doom a lot of these patients. I mean, these patients are seriously injured patients. I mean, like I said, they're in bad shape when they come in. Some of them have no chance or zero chance of survival when they come in and stuff. So to not do anything to give them a placebo or some sugar or hypoglycemia makes sepsis worse is pro-inflammatory too. So glucose pills are bad for septic patients or traumatic patients in extremis.
And my only other question was, has any other hospital tried adapting this in that way, looking at their numbers beforehand, and then trying a vitamin D style study, or is this just sort of coming out of your center there and starting to spread out through?
It's just coming out, spreading out. Actually, Emory puts all their ICU trauma patients on vitamin D now, so they've adopted the practice. So Emory Surgery Trauma has adopted the practice of putting all their patients on vitamin D. So this is just coming out. This is new research. It's tip of the iceberg. You're going to be hearing more about this stuff in the next 10 to 15 years. This is just the tip of the iceberg. So you're going to be hearing more about it. I mean, it's new, it's novel. We've just learned in the last 5-10 years that there are vitamin D receptors on every cell and tissue in the body. So we've just learned that it's a hormone. So it's going to take time for it to come out. You know, doctors are skeptical. I expect them to be. Actually, my doctors at my own place laughed at me, asked me why would a surgeon be doing vitamin D research, and so they still think it's a vitamin. So there are some things about it that we just don't know yet. And so you're going to see more and more research. And so, like I said, it takes an average of 10 to 15 years. So I'm fine with you disagreeing. I have no problem with that. But at the end of the day, my patients walk out of the hospital, I'm happy and stuff, and they're getting back on with their life. These are people that had no chance at survival, and they're doing well.